With over 2 years into this global pandemic, the chronic stress associated with it is taking a toll on individuals and organizations. New research by the Canadian Mental Health Association and UBC indicates most Canadians worry that COVID will never go away. On top of that, people are also concerned about what comes next, with concerns around new variants and recovering from pandemic-related trauma or grief. According to the study, researchers are seeing chronic stress in the population, which is making decisions harder, draining people's energy, and leaving many tired and burnt out. Meanwhile, community mental health organizations are drawing on shallow reserves to meet people's needs. Well, joining us now to tell us more about this latest research on mental health during the pandemic is Ms. Kennell, the National Director of Public Policy for the CMHA. Ma'am, welcome to Forum Daily.
Thank you for having me.
So what would you say are the key takeaways from this study?
Well, really, what the research is telling us is that the pandemic, no surprise, our fatigue has set in. Canadians are emotionally overwhelmed and exhausted. We know that a third of Canadians are feeling anxious and worried, and nearly half of Canadians feel stressed and worried about not being able to cope with uncertainty. People aren't getting the mental health supports they need, and we know that those needs are growing. And despite the fact that personally we know we can endure periods of crisis, and the systems that we rely on can endure crisis. 2 years in, though, the acute stress in the population and our systems is really becoming chronic stress, which is suggesting that if we don't act now, we risk further deteriorations in our mental health and cracks in our system.
I'm sure a lot of our viewers can relate to this. Now, considering this is round 4 of CMHA's research into the impacts of COVID, how does Canada's mental health currently compare to early on in the pandemic? Did it maybe improve?
Yeah, no, unfortunately not. Despite the fact that we saw the most significant deteriorations in mental health earlier during the pandemic throughout the course of 2020, we know that the numbers remain high. Many Canadians are continuing to express declines in their mental health, the highest being in May 2021, when 41% of the population expressed those feelings. Now we're down to 37. Similarly, 51% of Canadians express being worried or stressed about not being able to cope with uncertainty in 2020. This is now down to 39%. But what's really concerning for us is that we're seeing these numbers plateau. And so we're seeing heightened and sustained levels of stress, anxiety, depression, coupled with new stresses, including the emergence of new variants, that feeling of not being able to cope with uncertainty, the worry around COVID becoming endemic, and also the compounding stresses that we're feeling beyond COVID related to the climate crisis, to reconciliation with Indigenous people, to racial justice, the current crisis in Ukraine. These are all taking a toll on Canadians' mental health.
And on top of all of this, we mentioned community mental health organizations are drawing on shallow reserves to meet people's needs. So tell us a little bit more about the current state of mental health care in Canada.
Yeah, the pandemic has only increased the need for mental health services. We know through this research, and of course, anecdotally, speaking with friends and family, wait lists are long. Access to virtual services has been a tale of two pandemics for us. On the one hand, it's allowed those living in rural and remote areas to access mental health care for the first time. However, for others, it's led to barriers in access to care for folks who don't have access to reliable internet or cell phone plans, et cetera. We also know that the system is patchwork. It can be very confusing. It's a piecemeal kind of cobbing together of private, public, and community-based services. It can be really hard to navigate at the individual level. Furthermore, funding remains piecemeal. It isn't sustainable, and it's creating patchwork systems at play and a lack of sustainability. And finally, the toll that the pandemic has had on the community mental health workforce has been significant. We know that mental health workers are disproportionately affected by burnout and stress. They experience trauma on a day-to-day basis just by the very nature of the work that they do. They also have lower wages. So the impact the pandemic has been significant on Canadians' mental health, but also the people who serve them.
All right, just a quick 30 seconds left here, ma'am, but what steps need to be taken to improve this overall issue here?
We need political will and we need investment, really. These aren't new solutions, but really it's about ensuring that further investments are made in dedicated mental health services, particularly counseling and psychotherapy. We also need to seek greater attention on the social determinants of health, recognizing that mental health isn't in a vacuum. We need affordable housing, nutritious food, employment, stable and sustainable employment. These things are part and parcel of maintaining good mental health, so we need to see equal investment there as well.
Ms. Kennell, thank you again for joining us for this important conversation on Forum Daily.
Thanks for having me.